Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are talking about the overwhelming need to know it all.
I'm guilty of that for sure. Before we get started, we invite you to subscribe to our live videos so you'll be notified whenever it is we go online live, which is quite often. You can also subscribe to us on YouTube, like and share this video with your nursing friends. Be sure to follow our Facebook page and check us out on our website, www.n-powermentnursing.com. Lots of free content there for you to check out. So we, in our program, are on-call professors. What we mean by that is you can message us anytime with content questions, confidence questions, stuff like this. So I want to talk today about one of the most common questions I get, especially after people are engaged in a study process with our package. And that is, and I quote, "Do I need to know blank?" Usually you would insert some type of random skin disease that nobody's ever heard of in there. But it's quite common for students to totally overwhelm themselves with multiple resources. They'll buy every textbook they can find on Amazon. They're going to ask every friend who's written the exam. They're going to go in forums, get everybody's advice, and then they're going to end up with 7 different things in front of them. The issue with that is you start feeling overwhelmed, right? When you don't know what you need to know and you don't know where to start studying, even feeling overwhelmed like that will actually prevent you from getting started in the first place. For me personally, I've always said, and my motto as a student was always, tell me what I need to know and I'm going to know it. Make me responsible for that content and I'm going to master it. So for me, the big Nclex Dilemma was, for the first time ever, you don't know what it is you need to know. Thankfully for you, we do know what it is that you need to know.
So the point is that you could study for years and not know all the content. We are not textbooks. We're human beings. And because of that, we don't know everything. You're not supposed to know everything. Nursing is a career in which, for the rest of the years that you are at the bedside or wherever you're practicing, you're going to have questions. And guess what? You're going to reach to a textbook, or you're going to reach to an authentic source on your phone, and you're going to look it up, because that's what you're supposed to do. We are a self-regulated profession. And as a self-regulated profession, you are self-regulating, meaning that when you don't know something, you're going to find out, because that's what we do as nurses.
So hopefully you enjoy learning, because you're going to be learning forever and ever and ever. It's never going to stop. So let's talk about why students might feel the overwhelming need to know it all, right? You're doing practice questions and this skin disease comes up if you've never heard of that, and it gives you anxiety. Let's talk about the core content. The registration exam is testing you on entry to practice knowledge, not specialized knowledge. It's what the graduate nurse needs to know in terms of the core content. So I'm just going to read out for you our table of contents and our daily review, so bear with me. About the exam: body balance, endocrine system, respiratory system, cardiac system, renal system, GI system, neuro system, musculoskeletal system, pediatrics, maternal newborn, psychiatric, rules of management and delegation, diagnostic procedures, important one-pagers, that's my favorite chapter, critical thinking guide, testing tips. In the daily review package, which is our cue cards, let me tell you what's in there quickly. Lab values, vital signs for adult and child, accelerations, decelerations, APGAR scoring, fontanelle closure, lochia, stages of development by Erickson. Immunization schedule, cardiac intervals, cardiac rhythm strips, cranial lobes, Glasgow Coma Scale, range of motion, Fowler's positions, percussion sounds, BMI, ulcer staging, personal protective equipment, better known as PPE, conversions, blood compatibility chart, pharmacology review, meaning all of the drugs you need to know and not what you don't need to know, antidotes for overdose. So if you know all of this inside out and backwards, deeply and critically, wouldn't you think that's enough to succeed, right? We have the stats to prove that. We have a 99% pass rate, and that includes people who are writing their exam for 2nd, 3rd, 4th, 5th, 6th times and coming to our program. So we have the data to back up the fact that you don't need multiple resources.
Because they just overwhelm you.
Yeah, that's all they're going to do. So when you know the content in a way that's taught to you that's easy to understand, you can put a cap on that, right? Will you get a question on your registration exam you don't know the answer to? Yes. Will you get a question on the registration exam that you've never heard of? It's quite possible. But that doesn't matter because you don't need to know everything. You don't have to get every question right to pass. You could study for 500 years and still get a question on a registration exam about a skin disease that nobody's ever heard of. And it doesn't matter because it's not going to prevent you from succeeding. So put a cap on it. Make yourself accountable to this and only this, and that's what you need to know, and that will be enough for your success. That's our goal.
If you're looking to gain all the content, critical thinking, and confidence and fun, you need to pass your NCLEX CPNRE exam. We have complete NCLEX, NCLEX-PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you so much for joining us. We'll see you next time on In the Know.
Bye for now.